Bowel cancer affects thousands of people across South Wales each year. Here at Cardiff University School of Medicine, I'm researching new ways to treat this terrible disease by boosting the patient's immune system. Whilst working on my clinical trial, I was struck by the outcome of two particular patients, Gillian and Denise. Both were ladies in their late 50s, both had sons and daughters in university, and both were diagnosed with late-stage bowel cancer that had spread to their liver. They were both told they had 12 months left to live. So why did Denise respond to treatment and live for over 5 years past diagnosis, whilst Gillian sadly died within 8 months despite receiving the same immunotherapy? The work I'm doing here in the lab is uncovering some of these reasons why. One of the most interesting findings is that patients like Denise who respond to immunotherapy also appear to mount an immune response against certain strains of bacteria, like the one seen growing in this culture plate. Could it be that by administering patients with such bacteria, we could level the playing field so that all cancer patients are given the same fighting chance to respond to novel immunotherapy? With the help of you, the donors and the fundraisers, I aim to make this a reality. Thank you for your support.